Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hey everybody, welcome back to the show. It's great to be here with you today. Today's episode 2724 of the Cabral Concept. If you'd like to follow along with today's questions from the community, you are welcome to head on over to stephencabral.com/2724 for all of today's questions, as well as all sorts of links from the show. All right, let's dive in. You know you're here because we're trying to answer our community's questions on wellness, on weight loss or weight gain, on anti-aging, and as I always say, everything in between. I can't provide you with any medical advice, medical treatment plans, medical cures, or medical diagnosis, but what I can do is hopefully something better, which is begin to look at the underlying root causes for what might be causing your health issue in the first place. All right, let's see what the first question is. First one's from Sin. Sin says, CYN, maybe short for Cynthia. I'm not sure. But Sin says, hello, Dr. Ball. What are your thoughts on laser hair removal? Is it safe? Thank you. All right. So, this is not an area that I'm an expert in, but I've had clients obviously come to me and they've had laser hair removal and they've asked me before, is it dangerous? So of course I've done my research on it. I've looked it up because they're a private client and I want to be able to get back to them on their specific answers. So for the most part, I haven't seen anything like from a health perspective that could be a side effect, except for potential infections. That's basically it, right? So like if you're having a procedure done and you get a little cut or something like that, well, or a burn or anything like that, you could lead to an infection. But besides that, no, the only thing that I've seen are like blisters or like a burn that I just talked about, or hyperpigmentation, so the skin gets a little darker in that area. Sometimes that can happen. Sometimes loss of color. So one's called hyper, more, one's called hypo, less pigmentation, scars. That's about it. So, this has been around for a long time. They've pretty much perfected this. And I think that from a health perspective, again, no medical advice, seems to be very safe. All right? Thanks for writing it. Greg's up next. Hi, Dr. Ball. Thank you so much for all that you do. I'm a student of all that you teach, and I greatly appreciate all the time and effort you put into doing the research and sharing your knowledge. Thanks, Greg. Appreciate that. My question is regarding fiber intake. I maintain a healthy diet and track my meals daily. I've noticed that my daily fiber intake is 50 to 60 grams due to all the vegetables and other healthy foods that I consume. Is this too much? I understand that everything is based on bio-individuality, but do you recommend a specific range for fiber intake? Thanks for all you do. Thank you again. Okay, Greg, happy to help with this. It's actually pretty difficult to get 50 to 60 grams of fiber per day for most people, even with fruits and vegetables. Like when you look at a cup of veggies, for the most part, you're looking at like 3 to 5 grams of fiber. So even if you were to eat 2 to 3 cups per meal, which would be fantastic, you're looking at usually like 10 to 12 grams per meal. So then you're at about the 36 per day. And most people should shoot for 30 to 35 grams of fiber per day. And the people try to debate this. It's literally one of the number one things that have been proven to help with blood pressure, diabetes, cancer, as well as heart disease. All of the leading causes of death are improved by increasing fiber. All of them. And it's been known for decades. So again, people like to debate that. I think that because they just like to be controversial. Because if you're controversial on social media, you build a bigger name for yourself. I have no interest in being controversial. If I say something controversial, I'm not trying to be controversial. I'm stating what I know to be true based on clinical practice and research. Again, I'm not saying it's the end-all, be-all. I'm just giving you an unbiased perspective without just saying people should only eat organ meat all day long, right? Anyway, balanced approach. Trying to take a balanced approach. But 50 to 60 grams means that you are getting in, most likely, a lot of beans and legumes into your diet, which then have a considerable amount of fiber. Even nuts don't have as much fiber as beans and legumes. Now, having said that, if you're not getting a lot of bloating or gas or distension, I would not have an issue with someone taking in 50 to 60 grams of fiber per day. I would not. So hopefully that's helpful, Greg. All right, Leslie says, as I get older, certain joints bother me after strength training, walking, etc. Not anything that stops me from doing it, but definitely tells a difference on some days. Are turmeric shots good for joint pain and recovery, or would a supplement be more effective? So it really depends on the concentration that you're using. You can add ginger or turmeric to your smoothies in the morning. That would be great. And there's a product that I recommend and use called InflamaSoothe. It's a great product, and it contains all the known natural, healthy, and scientifically validated anti-inflammatories out there. Again, I'm not providing any medical advice or making medical claims, but it's part of our advanced renewal system. You combine Cell Boost and InflamaSoothe. It is a game changer. But if you want, just check out InflamaSoothe at stephencabral.com/shop, and you'll be able to see all the different herbs. So even if you don't want to use that product, totally fine. You get to see all of the ingredients that I use, and I think that that would be really helpful. If you want to just juice them yourself, you could absolutely do that. And for most people, juicing is about a half a thumb to a thumb of ginger and a half a thumb to a thumb of turmeric if you were to make your little ginger shot. You might just put like a little crack of black pepper in there if you'd like to help with some of that absorption. You don't need a lot. And all of those, that would be great. So you can definitely do that if you want. I like simple. I like easy. Yes, I add some turmeric powder in my shake a lot of the times, but I like being able to know the standard dose that I'm getting on a daily basis. That's just me. Andrea says, let's see. Thank you for your podcast. So grateful for you. What is your opinion on ozone therapy and hydrogen peroxide therapy in regards to curing cancer? Thank you. Okay. Well, so first of all, I have to give this statement. I'm not here to provide any cures for cancer. That will immediately get you canceled everywhere. So that's definitely not what I'm doing. What I want to say is this. Again, I like to always give an unbiased, balanced approach. So ozone and hydrogen peroxide therapy, there's not a mystery behind these. They are things that promote what's called redox. And I teach this inside of HPH. It's inside of module 6 of HPH. Now, if you increase the oxidants, so think about like ozone with an extra oxygen molecule, and hydrogen peroxide, if my chemistry memory serves me properly, it's H2O2 instead of H2O, right, for water. And so what they do is they have an extra oxygen molecule, which could be lent then to free radicals, right, providing that purpose of squelching that in the body. And they also have then extra oxidants, which can then cause destructive properties inside of the body to necrotic tissue, viruses, parasites, etc. Now again, am I recommending this? Not necessarily. If you do this, you want to understand there are also risks. Low dose for short periods of time of ozone, I've never had an issue with. Hydrogen peroxide, never had an issue. However, longer term, you can actually cause real issues and problems in the body because it's corrosive. Think about rusting the body from the inside out. Think about salt air on a vehicle, right? Like I always give the analogy, salt air in Maine on my Jeep that I have. I've got an old Jeep Wrangler. It just rusts out the bottom of it, right? So it's corrosive. You want to understand is that you can use these things to your benefit, but also it can be detrimental if done for too long or overdone. So you always want to work with a qualified practitioner and look deeper into them, okay? All right, Anonymous is up next. Hello, I got saline implants 10 years ago because I had extremely uneven breasts. I have learned about breast implant illness and don't know if I really have that, but I'm just worried about toxic load on my body. I really don't want to get them out because the unevenness is noticeable in shirts and bathing suits. Are there tests to check if it is negatively impacting my health or things to do to make sure it's not? Thank you. Yes, there are. So I understand what you're saying now. You got breast implants about 10 years ago. because your breasts were uneven. And you don't want to have them taken out because then the unevenness will be back there even in shirts you feel. Understood. I think that again, I'm not an expert in this space in terms of breast implants, but do understand that they can now use fat, I believe, from your own body in order to transplant that, take it from one other place. I think for many people, it's the thighs and the butt that they would transfer it to the breasts. But again, not an expert in that space. You just want to look into it more if you're thinking about getting them out. Now, having said that, many women in our practice have had them taken out. They've decided that because of breast implant illness, which could be caused from mold or the immune system causing inflammation based on trying to attack the implants. So you could run a couple labs, and they would be the Candida metabolic and vitamins test, the omega-3 inflammation test, and the mold toxicity mycotoxins test. And you can find all of those at stevencabral.com/shop. So then you'd learn a bit more about if you have mold or if the body is mounting a greater attack against the breast implants. Now, if you run your blood work as well with your PCP or you do it on your own, you'd want to look at CRP or high sensitivity CRP. And if that's above a 1, well, there's a greater amount of inflammation as well in the body. Okay? So something to look at. And then you can also do detox-based protocols. You can do mold-based protocols. But just keep in mind, if you look up, moldy breast implants, you will see photos online of mold growing around breast implants. So just kind of keep that in mind. All right, let's get to one more question. We try to do 6 every Saturday and 6 every Sunday. So let's see. Kate says, Dr. Cabral, recently got some blood work back and it showed a very high TGF-beta-1 number. I pointed this out to my doc who seemed nonchalant. This can't be good. I Googled and have mostly seen complex academic papers that are hard to understand. Can you explain what TGF-beta-1 is, why it might be high, and what to do about it? Yeah, happy to go over that with you, Kate. And, here's the thing. I don't know why you would even have that run. And so, meaning it's just not typical blood work. It's good to have a run, no issues at all. But your doctor or someone must have been looking for something in order to run TGF-beta-1, which is just a transforming growth factor. And what it's looking at is a high number. Typically, it indicates, again, not giving you medical advice or diagnosis, it indicates an inflammatory process in the body. We don't exactly know why, but there's something going on in terms of high glucose levels, maybe even super high protein intake, maybe. Could be, again, not giving any type of diagnosis. Could be a fibrosis, could be a type of cancer, could be a type of inflammation. I don't want you to jump to any conclusions. I want you to work with your doctor and simply say, if the number is really high, shouldn't we follow up, right? Or you can go to another doctor. There's no law that says you are not allowed to get a second opinion. You are, right? And so then you just want to look at what's going on. Because it might just be elevated levels of mold, elevated levels of something else that's causing an inflammatory process in the body. So don't jump to conclusions. I don't want to put the nocebo effect in your head that there's anything wrong. What I want you to do is, of course, get you the care that you deserve. And so you deserve to figure out, why is this number elevated? Why did your doctor even run in the first place? Because it's not typically a number that's run on just your average, wellness-based blood work that you have run, which is your lipid profile, your CBT, your CBC, your metabolic profile, et cetera. So hopefully that was helpful. I appreciate all of you tuning into the show today. I will be back answering more of our community's questions tomorrow. Have a great rest of the weekend. We'll talk soon. Take care. I want to sincerely thank you for your support of this podcast. I couldn't do it without you, and I mean that. I truly do. I also want to make sure you knew that we now have multiple ways for you to find your answers to the most difficult health, wellness, weight loss, and anti-aging questions. You can find podcast-specific topics like thyroid, adrenal, hormones, sleep, digestion, Ayurveda, and many more at stevencabral.com/podcasts. That will then link you to your favorite Apple, Spotify, and other podcast players. Plus, all new podcasts and weekly exclusive video content is being added to our YouTube channel at youtube.com/Stephen Cabral. And that's Stephen with a PH. Head on over and subscribe so that you don't miss any of the exclusive content. Lastly, if you've ever found any of my podcasts or books to be helpful, I would really appreciate it if you could leave a review on iTunes or your favorite media player for the podcast. Rating and subscribing to the YouTube and podcast allow me to reach more and more people and help spread my mission of healing throughout the world. Thank you again for being a part of this movement.